Okay, team. So, high yield concepts in terms of the nervous system, things that can be questioned often in the exam situation, and whilst you're under the pressure of nerves, things can slip our minds. So, best way to remember these, as you can see, there are 5 things I want to talk about, and the first I'm going to kick off with is this fella here, afferent versus efferent. So, a very quick diagram. My standard, unfortunately, is not very high when it comes to art. Here's our receptor, here's our stimulus, and here's our spinal cord, so SP cord. Okay, and here's our effector organ, be that a muscle or a gland. As I say, that's as good as the drawing gets. Okay, so we've got a signal coming in, and we've got the dorsal root ganglion and things coming from the back, okay, into the spinal cord. And the way we remember that is that we get stabbed in the back. As dark as that sounds, I'm so sorry, and as low as it sounds, but we often get stabbed in the back. And that's how we remember that the nerve actually goes into the spinal cord from the dorsal horn. Okay, the dorsal horn is this here, dorsal root ganglion. Remember, this is a whole set of cell bodies, and this is your ventral horn over this side. And then what we remember is we tell someone to F off. And so F referring to F for F and F for F leaving. So efferent nerves are the ones that leave the area. Okay, enough said. Aside from that doom and gloom, cranial nerves. Okay, so we remember that we've got 12 pairs of cranial nerves. Okay, 12 pairs, not 12 cranial nerves. We've got 12 on the right and 12 on the left. And the key is that you have to remember where they leave the brain, and or what part of. So we understand we've got the forebrain, midbrain, pons, and medulla, and I've written here 2, 2, 4, 4. And what this essentially refers to is that the cranial nerve number 1 and 2 leave the forebrain, 3 and 4 leave the midbrain, 5, 6, 7, and 8 are the next 4, and then of course leaving us 11, 9, 11. So the point here is that these are the cranial nerves that leave these areas respectively, and all you've got to do when it comes to an exam situation or setting is you remember 2, 2, 4, 4, and forebrain, midbrain, pons, and medulla, and then just work out which of the cranial nerve it is that sits in that region. Okay, hope that helps. Next in line, we've got S234 keeps the 3 P's off the floor. A big one. Okay, so this is really, really important. S234 refers to sacral nerves. Remember S for sacral, so again, C spine, cervical spine, thoracic spine, lumbar spine, and sacral spine. And then, of course, we've got the little coccyx, which has got 3 vertebrae. They don't do much at all. There are no spinal nerves associated with them. So S234 sacral nerves number 2, 3, and 4 keep the 3 P's off the floor. And the reason they do that is because when it comes to the poop and the pee, your urethral sphincter and your external anal sphincter are both innervated by this set of nerves. Hence, those sphincters, again, remember, they are very, very highly toned, and so they will remain closed until you activate this area here. And so that what it'll do is it'll loosen the tone, allowing you to urinate or pass an episode of urinary avoidance. And when it comes to the external anal sphincter, and internal for that matter, whichever one you want to go with, then you will get the anal sphincter releasing, allowing the process of defecation. The penis is not associated with the urethra, rather this is all to do with keeping the penis off the floor, so that's your erection. Okay, this is also controlled by the S234. So understandably, what you conclude from this is that this region is all parasympathetic, okay, because this is all rest and digest functions, and that's what this is all about. Okay, now while we're on that topic, we then go to point and shoot, and this is referring to your penis, and what you've got is your P for point, okay, is P for parasympathetic, and I'll change the color so that we can visualize, yeah, and S for shoot and S for sympathetic. So the add another color, why not? And so your parasympathetic allows for erection, and your sympathetic allows for the ejaculation. Okay, so point and shoot, P for parasympathetic, S for sympathetic, and your parasympathetic will promote this, i.e. the pointing, and then the shooting is actually the ejaculation. Okay, and finally we have the pupil. Okay, now this one is very commonly incorrectly done. So here I'm going to draw as best as possible the pupil, and then I've got my iris. Okay, and we have got, I'm going to try and do this as best as I can. So we've got two sets of muscles, okay, in the colored part of our eye, i.e. our iris, and the first one I've drawn here is radial muscle. Okay, radial muscle. And when radial muscle contracts, what's going to happen is that it is going to pull the pupil outwards, and so you're going to allow for dilation. Okay, and then your constrictor, and I'll go into the main bit that I want to really discuss in a moment. So your constrictor are circular muscles like this, and understandably when you constrict circular muscles it will pull the whole thing inwards. Okay, and so you'll get constriction due to the circular muscles. Now, which of these is sympathetic and which of these is parasympathetic? And this is the most important bit. So remember this. There's a concept, albeit anecdotal, when you look into someone's eyes, and if you're physically attracted to them, it will cause dilation of your pupils. Okay, so remember this fun fact. There's a psychological trait actually. If you want to really get to someone or make them feel a little bit at unease, keep looking into their eyes and at the color of their eyes. So a couple of dark things there, of course, as well, from a psychological standpoint. But going back to what I said a moment ago, look into someone's eyes. If you're physically attracted to them, then you will get dilation of your pupil. And what also happens then, if there is an element of physical attraction, well, your heartbeat goes up, your heart rate goes up, and you get all of this adrenaline rush that starts to occur. Okay, now all of this is to do with sympathetic function, as you quite rightly remember. And so what you've got is this whole thing is instigated by your sympathetic nervous system. So the way to remember that is that law of attraction. Okay, attraction causes pupillary dilation, and with that you get this whole palaver of sympathetic tone increasing. Thus, the dilation of your pupils is sympathetic, leaving the constriction to do with parasympathetic. Now, there is an actual theory behind this, and that's when we come to study your cranial nerves, oculomotor nerve, cranial nerve number 3, and you recognize that it's a motor aspect. The oculomotor is primarily a motor nerve, and that's what actually does all of this function and controls it. But these are your memory aids. Thank you for watching, and stay tuned.